Today we will be conducting the Western Kentucky University Motor Speech Examination. This is my husband David, who is kindly letting me use him as my client today. Alright, so David, do you have any neurological problems that you know about?
Nope.
Alright, so no issues there, that's good. Alright, so now we're going to look at facial symmetry. So if you just stare straight ahead, everything is pretty symmetrical. No person is exactly 100% symmetrical, but you have no clear issues. If you would look to the side this way, please. Okay. And to the other side. Alright, facial symmetry is good. Alright, now we're going to look at your mandibular structure. So if you would again turn your head to the left and to the right so we can look at the mandible structure. Again, no problems there. Looks very normal and structurally appropriate. Alright, we're going to look at your lip structure now. So can you please just close your lips together, like pinch them together? Okay. Can you pucker your lips? Okay, that looks good. Can you smile? And then smile really wide. Okay, looks good. Alright, now we're going to look at your tongue structure. Can you please lick your lips? Okay, and can you protrude your tongue for me? Okay, that looks good. You can unprotrude it now. Alright, now we're going to look at your dentition. Can you open your mouth for me, please? Okay, we can see here down on the bottom that his dentition is normal. Okay, let's look here at the top. Okay, again, we have good normal dentition. Okay. Alright, let's take a look at your hard palate. If you would open your mouth again for me, please. Okay, his hard palate does not have any structural abnormalities or any scarring, and his soft palate also appears to be pink and healthy. His soft palate again also appears to look pink and healthy. Okay. Okay, and you can see that he does have a palatal torus there on the roof of his mouth. Alright, if I could get you to put your tongue forward for me, and we're going to say Good job. You can see his uvula. And let me get a better angle. Alright, say aw for me one more time. Okay. Alright, open your mouth again for me. Okay. Let's look at his palate elevation. Looks very healthy and symmetrically normal. Say ah for me. Say it again. Okay. Alright, everything looks healthy there. Your pharyngeal walls do move in appropriately when you say ah, and your proportion between your velum and your pharyngeal wall looked good. Okay, now we're going to check your gag reflex, which will bring everything forward. It brings the backs of the tongue forward and the pharyngeal walls kind of tighten up. It's a natural reflex. We're going to check it on you, sir. If you'd open your mouth. Let's see. Gag reflex is present and healthy. Okay. Okay. Alright, we're going to check your velopharyngeal. Alright, we're going to look at your velopharyngeal function to test velopharyngeal closure. I think you should note that the patient is, or the client is congested with seasonal allergies right now. So I'm going to have you make the sound Okay, and there's some fogging there, and for me again. Okay, perfect. Alright, I'm going to also have you say the word humbug for me, alright?
Humbug.
Okay, perfect. There is no fogging on the B sound in humbug, so that indicates good velopharyngeal closure. I'll have you do that again.
Humbug.
I'll have you say that for me. Hold on. humbug for me one more time.
Humbug.
Okay, again, that looks healthy, indicating a good seal. All right, do you ever feel like you have problems with saliva control?
No.
No? Okay, wonderful. All right, and we're gonna have you count to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. And do you ever feel like you have problems with breath control or run out of air when you're talking?
No.
No? Okay. All right, if you could look to the right for me and to the left. Okay, his external ears appear normally formed. You can look forward for me. And those form at the same time as the internal ear does during gestation, so it's an important marker for if there's any, inner ear malformation. But yours look healthy and normal. Okay. Now we're going to look at your trigeminal nerve function, so how it affects motion is what we're going to look at right now. Can you open and close your mouth slowly? And one more time. Okay. And can you open your mouth for me again? One more time. Okay. And resistance this way, open and then close, and open and close. Okay, that looks good as well. Can you stick your jaw out and protrude it and retract it, pull it back in and out again and in again for me? Thank you. Okay, I'm going to feel your TMJ joint while you do that for me one more time. Okay, and can you open and close again? Okay, I'm not feeling any dysfunction with your TMJ joint. Do you notice any problems with it ever?
No.
Okay. Not feeling any clicking or popping, so it looks good. All right, can you move your jaw side to side for me? Okay, and can you click your teeth together? Perfect. All right, I'm going to have you clench your teeth for me, and I'm going to feel your TMJ muscle, your masseter muscle. Okay, good. That feels good. And all right, I'm going to put my hand under your chin, and then I'm going to ask you to clench your teeth for me so I can feel your muscle down here. Okay, good. I can feel it. And do it one more time for me. Okay, good. All those muscles are functioning properly. All right, and if you would close your eyes for me, sir, I'm going to test some sensation. Okay. All right, do you feel anything?
Yes.
Okay, and here?
Yes.
And here?
Yes.
Okay. What about here?
Yes.
Here?
Yes.
And here?
Yes.
Okay. And here?
Yes.
All right. You can open your eyes again. All right, I'm going to ask you to say the word pa 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 as fast as you can until I tell you to stop. All right, that was great. Okay, now we are going to look at your facial symmetry, which we did earlier, but just to look at it again, and you do look symmetrical. All right, I'm going to have you lift your eyebrows and wrinkle your forehead. Let me move this angle a little bit. All right, you can relax. Can you close your eyes tightly for me? Perfect. And can you pucker your lips for me? Okay, good job. All right, can you smile for me? All right, that looks good. All right, and now I'm going to have you show me your teeth and then pull down hard on the corners of your mouth like you're going to growl like this. Say grr. There you go. Perfect. All right, and now can you puff your cheeks for me? And now I'm going to have you alternate puffing your cheeks, kind of like you're swishing water, so puff one side and move the air to the other. Okay, good. That looks very good. All right. We're going to use this as a bite block, so I'm going to have you open your mouth for me. Okay, insert that for you right there. All right, can you say puh 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 again for me? As long as you keep
Okay,
very good. You can take that out now. You can or I can, either way. Thank you. All right, that looks great so far. Okay. Now we're going to do some tasting tests. So I'm going to have you, in a minute, I'm going to have you open your mouth and stick out your tongue, and I'm going to put a tasting agent across your tongue, and I'll ask you where you can taste it. There we go. Okay, I'm going to have you stick out your tongue, and we're going to put the tasting agent on your tongue, and we're just going to have you tell me if you can taste it or not on the different areas. All right. Okay. Can you taste it here?
Uh-huh.
Okay, and here?
Uh-huh.
Here?
Uh-huh.
Here for me?
Uh-huh.
And here?
Uh-huh.
Here?
Uh-huh.
Here?
Uh-huh.
And here.
Uh-huh.
Okay, you can close your mouth. You can take a drink. And what taste did you taste there?
Sour.
Okay, good. All right. Alrighty. If you can stick out your tongue for me again. Alright, can you taste this here?
Uh-huh.
Okay, and here?
Uh-huh.
How about here?
Uh-huh.
Here?
Uh-huh.
And here?
Uh-huh.
And here?
Uh-huh.
And here.
Uh-huh.
Okay. And so you can taste that one everywhere as well, and that was
Salty.
salty. Okay. You can take a drink if you'd like. You could protrude your tongue for me again, sir. All right, can you taste it here?
Uh-huh.
And here?
Uh-huh.
Here?
Uh-huh.
Here?
Uh-huh.
There?
Uh-huh.
And there?
Uh-huh.
And there?
Uh-huh.
Okay, good. What did that one taste like to you?
Bitter.
Okay. You can take a drink for me. Okay. Last one for us here. If you would protrude your tongue for me again. Alright, do you taste it here?
Uh-huh.
And here?
Uh-huh.
Here?
Uh-huh.
Here?
Uh-huh.
Here?
Uh-huh.
Here?
Uh-huh.
And here.
Uh-huh.
Okay. Perfect. And that one was
Sweet.
Okay. Alright, we're going to take a look at your palate, so if you could open your mouth for me. Okay. Alright. And if you can say "ah" for me. Okay. That looks good. And look at your palate at rest. It also looks good. Okay. I'm going to do test your stroking reflex. I'm going to just touch different areas of your palate and see if it moves. Okay. Alright. Take a look at your nasal emissions during speech. I'm going to have you say, "Sammy sees a snail." Alright, say "Sammy sees a snail" for me.
Sammy sees a snail.
Perfect. And "Sammy sees a snail" again.
Sammy sees a snail.
Okay. Alright, I'm going to have you say that for me one more time. Sammy sees a snail.
Sammy sees a snail.
Okay, and as you can see, there was no fogging. Alright. and now I'm going to have you say several different words for me. Alright, can you say cat?
Cat.
Okay. Cat?
Cat.
Okay. Game. Wait, hold on one moment. Game?
Game.
Okay. Game.
Game.
And baby.
Baby.
Okay. And baby.
Baby.
Okay. And I'm going to have you blow on this tissue for me. Alright, so blow your nose forward. Just blow out your nose. Perfect. Alright, so I'm going to have you protrude your tongue and then puff out your cheeks. Okay, perfect. Now move your cheeks side to side like we did earlier with your tongue still out. Okay. Can you do that for me? Okay. I'm going to have you protrude your tongue out for me again and then move the air from side to side like we did earlier. Can you do it without moving your tongue for me? Okay, good. Okay. You inhale deeply for me and hold your breath with your mouth open. Exhale whenever you are ready. Okay, and you can do that for me again, please. Okay. Good. All right. So then I'm going to have you say, take a deep breath and say a couple different sounds for me. So say ah, as long as you can. And if you can do that again and say s for me. Okay, and if you can do z for me. Okay, and we're going to repeat that one more time. First with ah, then with s, and then with z again. So can you do ah for me? Okay, and s for me. Okay, and z for me. Okay, and I'm going to have you match my pitch. So we're going to do a low sound, so ooh.
Ooh.
Okay, and a medium sound.
Ooh.
Okay, and a high sound.
Ooh.
Okay. All right, and can you cough for me? Okay, and can you clear your throat for me? Perfect. All right, I'm going to have you look to the left. Okay, can you turn your head for me against my hand? Okay, and look to the right. And turn your head towards my hand. Okay, and I'm going to have you push your forehead towards my hand. Okay. Okay, and I'm going to have you push your forehead towards my hand for me. Okay. Okay, and can I have you shrug your shoulders for me? Okay, good job. Alright, now we're going to take a look at your tongue for a moment. Okay, let's move this a little closer here. Alright, can you open your mouth? Alright, your tongue at rest looks normal. No, it's pretty symmetrical. No damage or anything. Alright, can you protrude your tongue for me? Okay, that looks good. And can you pull your tongue back in for me? Okay. Can you move your tongue from side to side? Okay. Can you Alright, and then I'm going to have you stick out your tongue and raise it and try to touch the stick for me. Okay. And can you pull your tongue back in again? And I'm going to have you stick out your tongue again and try to touch the stick. Okay. Looks good. Alright, can you push your tongue inside your cheek against my fingers? Okay. Good. And on this side. Okay, good. Alright, can you say ta 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 for me? Okay. And can you say ka 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 for me until I tell you to stop? Okay. Alright, and I'm going to have you do that again with the bite block from earlier. Okay, and now with the bite block in, can you produce ta 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 for me again? Okay. And ka 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 for me? Okay. Alright, we can remove the bite and you go padaka 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 for me until I tell you to stop.
Padaka, 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 padaka.
Okay. Alright. And we'll have you say padaka again for me one more time.
Padaka, 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 padaka.
And we'll have you say I'm gonna have you say ta 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 one more time for me again. And ka 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 for me again. Okay.
Getting tired.
And here's the bite block for you. I'll have you do the pa 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 and the ta 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 one more. I'll have you do the ta 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 and ka 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 again for me with the bite block. Okay. Have I had you say padaka with the bite block in yet? Okay, padaka with the bite block for me.
Padaka, 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 padaka.
Okay, and one more time. Padaka with the bite block for me.
Puttica, 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 puttica.
Okay. All right, you can remove the bite block now. All right, we already tested your gag reflex and saw that that was normal. And we're going to test a few oral reflexes. Some of these are not, normally present in adults, so don't worry if they don't show up for you. Okay. So just keep your mouth, closed, and then if there's any reflex, that's fine. Okay. All right. And now we're going to look for the sucking reflex. Okay. And okay. And if you could open your mouth for me again. Okay. All right, good. All right. And I'm going to have you cough for me. Okay, and click your tongue like this. Okay. Can you blow this tissue? Perfect. All right, puff out your cheeks. Okay. And stick out your tongue. Okay. And you can can you stick out your tongue just with your cheeks normal? All right. And lick your lips. Okay. And make your teeth chatter together like this. Perfect. And can you buzz like a bee? Okay. Smack your lips, then cough, and then cough.